Well, good afternoon. As we reconvene the commission hearing, we look forward to you joining us as our colleagues come and our next speakers come forward. So we appreciate you all being able to be back with us for California Commission on Aging's hearing on homelessness and housing. So we are moving to our third panel of four. And again, we are holding public comments until afterwards, as we will have a chance to wrap up today and also talk about next steps from all the important material that's been shared with us. So at this time, we are starting with our third panel entitled, What's Holding Us Back? The financial and regulatory barriers blocking supportive housing. And as a preface, a brief comment. As older adults have become the fastest growing segment of the homeless population, it is apparent that the production of housing to serve older adults has not matched the demand. Our third panel represents providers and developers of supportive housing settings who are targeting their work to older adults. And through this panel, we will look to understand the funding gaps, regulatory hurdles, and workforce shortages that make it difficult to build and sustain supportive housing and for older adults and really at the scale it's needed. So we're delighted to welcome for us our two panelists, Harrison Linder, Assistant Director of Housing Policy at Leading Age California, and Sahar Soltani, Director of Housing Finance at Mutual Housing California. Welcome. So we can start, and I believe our first speaker, if we have the order correctly, is Harrison. Thank you.
Thank you. Yeah, thank you so much, Commissioner Lindeman. My name is Harrison Linder. I'm the Assistant Director of Housing Policy with Leading Age California. Leading Age California is a industry association that represents nonprofit providers of housing, care, and services for older adults. We have around 400 members across the state of California, or sorry, 800 members across the state of California. Around 400 are affordable senior housing providers. Those are who I mostly work with. So my expertise really lies in affordable senior housing, both on the development side, the operations side, and also know a good amount about the different kinds of other services and supports that low-income older adults use, like certain Medi-Cal programs and things like that. I think you're going to hear a lot of statistics today about the need for affordable housing for older adults and the need for services for older adults who are experiencing homelessness. I really want to focus in right now on the statistic that you'll see in the top right corner of the screen. There are 3.2 million older adults in California who are cost burdened by housing. That means that they spend 30% or more of their gross income on housing. This is a metric set by the federal government, and it essentially tells us that there are 3.2 million older adults in California who are at risk of not having stable housing because they're spending too much money on it. And, I think we can think of the scale here. 3.2 million is a lot of people. That's like something like 8% of our entire state's population. This is a really big group, and we need to think hard about what we're going to do for them. So we talked a little bit about the demand, and I'm sure you're going to hear a lot more about the demand as the conversation goes on. But now let's talk a little bit about the supply. And this isn't on the slide, but just to give you some background, there's probably around 90,000 units of affordable senior housing in California today. Around half of them are deeply subsidized, meaning that the people who live in them do not pay more than 30% of their income uh, on that housing. These subsidies generally come from the federal government. The other half are not necessarily deeply subsidized. They can have rents that are actually quite high. There's affordable housing units in the Bay Area and in Los Angeles where rents are easily above $2,000 a month. And for someone who's on a low fixed income, which is a lot of the older adults in California, that is not sustainable. They need to be on something much more tied to their income, like the deep subsidies are. So looking at this graph, I wanted to give you all a sort of idea of where we're at and where we're going in terms of our supply and demand. So the green bars represent the approximate number of affordable senior housing units being produced in each of the years, and the orange line represents the net new number of older adults in California who are using homelessness services. These numbers come from the HDIS integrated dashboard data system. So all the continuums of care put their data together to give you these approximate numbers. So at first glance, this graph could be a little misleading. It might seem like we're producing about the right number of housing units for the need, um, but first of all, let's look at the scale. So you'll see on the left side of the graph, our number of housing units, the scale only goes up to 2,000. On the right, the number of homeless people goes up to 12,000. So in each of these years, we're seeing 3 to 8 times as many new older adults accessing homelessness services as we're seeing new units of affordable senior housing. And on top of that, this graph in another way is not perfect because these units that are being produced, these are not necessarily well suited for the people in the orange line. The green bar, those numbers of units, those do not have a lot of services attached to them necessarily. And for these older adults who are experiencing homelessness, they probably need permanent supportive housing. And I'm sure my co-panelist Sahar will talk a lot more about that. These affordable senior housing units, they are a little bit better suited for older adults than a typical affordable family housing unit is. They have certain design aspects that are better. They also often have certain services like a service coordinator, which is basically an on-site social worker to help older adults remain stably housed, but they definitely do not have the deep services that many formerly homeless people need to stay stably housed. So the takeaway that I want you to grab from this graph is we need to do a lot more in terms of prevention because we're not just going to be able to build our way out of this problem. There's not going to be enough new housing units produced to house all the people who are experiencing homelessness. And they're not necessarily even going to be that affordable with the tools we have in our toolbox today. So this problem is definitely very big, very expensive from my perspective. We need to be spending much, much more money on it as a nation, frankly, if we're really going to dig ourselves out of the problems we have. But there are definitely ways that our programs could be tweaked and could be improved. To talk a little bit more about the main ways that affordable housing are built in this country, including California today. Um, Basically, the cornerstone program is the low income housing tax credit program. How that program works is that um, tax credits are issued to an affordable housing developer who's then able to sell those credits on a marketplace to typically large corporations looking to reduce their tax liability. So that corporation then buys those credits for some discount on the dollar. So it's probably they pay like 90 to 95 cents on the dollar for those credits. So they get a bit of a good deal on their taxes. And then take like a minor partnership stake in the development of the building. And then that money from the sale of those tax credits goes towards the deal. And this program is not great. It only pays for, in every case, a portion of the total cost of a building. In some cases, it pays for a lot more, depending on the type of tax credit. But because it doesn't pay for all of it, developers are forced to find other areas for gap financing. So in California, we have the multifamily housing program, along with a lot of other programs. These are mainly, developed to provide gap financing for this low-income housing tax credit program. There's also other federal grants. Lots of local governments put out their own gap financing programs as well. And with every additional layer of funding that a developer needs to get, and I'm sure Sahar can talk very personally about this, it adds additional complexity, additional compliance burden, additional cost. I believe there was a study that found there was like tens of thousands more cost per unit with each additional um, layer of funding that you need to put on it. So this is not the greatest program, in my opinion. It does a good job of providing a bit of a tax break, but it makes it really hard for developers of affordable housing. This is definitely in contrast to some historic programs that are barely funded at all anymore. So the flagship affordable senior housing program that HUD for many years pushed was the Section 202 program. They still issue some new Section 202 grants to build new affordable housing, but it's like maybe enough for at most 10 buildings a year across the entire nation. Not very many. At the height of America's production of affordable housing, we're producing like 500,000 units of affordable housing a year. We're nowhere near that. Um, so yeah, but in contrast, the Section 202 program, not only did it pay for basically the entire deal, the entire building, it also ensured that there was deep subsidy attached to the units. So, in so many ways, much better than what we have today. Today, it's much more complicated, and the outcomes of like what you get are not necessarily as good as well. Moving on to talking about assisted living. Now, this is not exactly my area of expertise, but I know I got some questions in my packet about this, so I wanted to talk about it a little bit. The main thing that I would just want to state is there isn't really such thing as affordable assisted living. For high quality private pay, we're talking about many thousands of dollars a month. This is only really available to some of the highest income and highest wealth individuals in our state. At the very, very low end, for Medi-Cal enrollees who are nursing home eligible, there's the assisted living waiver and some other programs that provide something similar that can put someone in a relatively high quality assisted living situation, but reimbursements are kind of off. It's only offered in a certain number of counties, and there's a cap on this program for the number of people who can be enrolled. I believe it's at 10,000 right now. So really small portion of the number of eligible people for this program actually get it. So, and for middle income people, good luck. Maybe you pay privately for a 6-bed facility, but that doesn't necessarily give you the kind of care that you would need in if you are really in need of assisted living care, like the kind that when you typically think of assisted living. And moving on to workforce as well. Again, not exactly my area of expertise, but the workforce challenges are definitely very frightening from my perspective. Um, you know, they're the numbers are pretty staggering. It's apparently we need about as many direct care workers as we have low older adults who are housing cost burdened. That's a lot. So another 8% of our total state population potentially that we need for direct care work. How are we going to get there? I don't know. Right now, when it comes to a lot of essential roles in housing and especially like homelessness services, um, these jobs don't pay particularly well, and they're also kind of uncertain. Homelessness funding comes and goes. It's always discretionary. Lots of programs get stopped like in the middle of providing services and then get started back up again. Job security is not good. Wages are not good. I don't know why anyone would want to do those jobs unless they really, really care about them. And I think it's borne out in statistics. Turnover in these kinds of roles is really, really high. And you need to do something different if you want to have smart people, talented people who want to stay. You need to pay them more. You need to figure out how to give them some job security. You need to give them some kind of ladder upwards. None of these things, as far as I can tell, or in rare cases, this occurs, but it's not very common. So that's my main takeaway there. And really, when it comes to workforce, especially when it comes to the medical care, like when it comes to nurses, this is a global shortage. Like the Philippines, which provides 25% of global migrating nurses and 20% of California's nursing workforce, they have a nursing shortage. They might start limiting the number of nurses that they allow to move anywhere, including California. And then what do? We have some programs to try and build our workforce, but it's like a drop in the bucket compared to the need. So I don't know what the solutions are, but I just want to make sure you all are aware of the problems. That is the end of my presentation. Have some references, so hopefully you get a chance to look over the slides later. And I'll pass it over to Sahar.
Thank you, Linder, for that broad overview of those key factors driving some of the challenges. Yes, please.
Great, thank you. Is this good? Loud enough?
Very nice.
Great. Good afternoon, commissioners. My name is Sahar Soltani. I'm the Director of Housing Finance at Mutual Housing California. First, I want to really congratulate you on leading this conversation and bringing such diverse group of people who cover different aspects of what goes into actually bringing these units to production, getting them occupied, and then supporting them with services for long term. So this is super valuable conversation, and I hope that other groups continue to really support this effort. With that, I want to give a little bit of background about Mutual Housing. We are a nonprofit housing developer, operator, and also community development and resident services provider. We are out of Sacramento, based here, and mostly develop projects in the Sacramento region. My role is really bringing in the financing that takes projects from concept to construction and then operation. So really, we are talking boots on the ground, what it takes to build these units. And I definitely forgot about the slides, so continue here. There we go. So I think I can start with good news, and that is that we know what works when it comes to producing these units and being able to sustain them long term. We have success stories, and we know what makes them possible. And there are project showcases to testify to that. However, there is a big challenge, and is how do we scale that production? How do we replicate what we know how to do in the face of really big challenges when it comes to funding? Before we really dive into the conversation, I want to build on what Harrison mentioned and really identify the different terminology you might hear when it comes to housing. There is market rate housing. That's just standard what is available in the market. Usually any additional services, amenities that are necessary if they are for senior housing or assisted living, the resident is going to be paying a higher price for that. So these are not income restricted or rent restricted. The next level is rent and income restricted. This is mostly referred to as capital A affordable, which means the tenants should have to qualify for a specific income range in order to be able to take advantage of restricted rents for their units. And this is, usually driven by the programs that Harrison mentioned earlier, the low-income housing tax credit program, some of the state funding, and are, restricted for long periods of time. For California, that's usually 55 years, based with regulatory agreements. The third layer, which I think is the most interesting for the panel today and for the commission, is the subsidized supportive housing. So this is an additional layer that comes with providing services to those units that are attached to the unit itself. So the service, the care that comes with those units doesn't go away when the tenants moves out. It's there, it's committed to the project, and it's sustainable in 15, 20 years or even longer term periods. So that is kind of what you'll hear as permanent supportive housing in general, and the same concept applies for the senior or aging adults. There we go. The statistics are clear. The need is growing, and it's going to grow faster in the next 2 to 3 years when we do the next continuum of care and point in time count in across the state and in the Sacramento region as well. And with that, I want to share a little clip from a documentary that our team put together for Wong Center. It's one of our senior housing communities here in Sacramento, to just put a face to who we are talking about to serve through these programs. Do I hit play or?
A study by the Public Policy Institute of California found that about 30% of California's older adults rent their homes. These senior renters often face greater financial challenges compared to homeowners because they have lower incomes and housing costs continue to rise. As they get older, many renting seniors struggle to maintain stable housing. Today, people aged 65 and older make up a small portion of homeless Californians. However, this group's rate of homelessness has increased the most of any group over the past 5 years.
I mean, for me, this is basic. Arenas are great. Parks are great. Tree canopy is great. But if we can't house people, shelter people in the immediate term, we're failing as a community, and we need to be doing more to prioritize that.
According to the 2024 Point in Time Count study, in Sacramento County, nearly 20% of those identified as unhoused were seniors aged 55 and above. As the number of older adults continues to grow, the population of low-income seniors from all racial and ethnic groups is expected to rise as well. Many longtime locals are struggling to find affordable, stable housing. Seniors from some ethnic backgrounds also face additional challenges, such as language barriers, lack of culturally competent services, and economic insecurity. These factors make them even more vulnerable to displacement.
Hard year being homeless, not knowing where I'm going to sleep, not knowing where I'm going to eat or what I'm going to eat. It was difficult. And I think that coming through that has been such a learning experience.
We lost our house because we didn't have title lock on our property, and somebody scammed us out of our property. So that's how we ended up homeless. But that was a horrible experience.
And there is a link to the full documentary if you're interested later to check out the full story. So the need is real, and this is not just a housing issue, right? This is a health concern, this is a community concern, and ultimately leading to homelessness and becoming a ever bigger challenge. So how do we replicate what works? I'm going to really simply put the financing part of it, because ultimately what it comes down to is how do we get capital and operational sources, so dollars, in order to build the housing that is going to house the individuals. So really we can look at this as sources of capital and then uses of them. That goes into the construction of the project, and then operations. So how do we keep this product operational and stable in the long term? Because we are committing to 55 years of restriction, and how can that be possible? On the sources side, we already covered some of the federal sources, state sources. There are a variety of different compilations that you can make in order to serve specific populations. I think there was a question earlier about, is there a set aside for senior housing? And unfortunately, as the HCD representative mentioned, there isn't. There are housing type goals, so you could set aside units for senior housing, and that helps the state to achieve its goals in distributing the tax credits, for instance. And they have a limitation. So there is some layer of surety there, but not as much as there needs to be. When it comes to uses, it's really basics of the development. There is land, design and permitting, getting into construction, materials, labor, and the financing fees. So not a lot of complication. It's very straightforward, same structure of developing real estate. And then it gets really tricky when it gets to operations, because now you really need to cater to the demographic group that the project serves. And operations are key to these projects, to their success. The operational funds that get committed to these projects actually make or break them. And they are the defining factor on what a gap we are trying to solve for when it comes to sources of funding. So if we take every section on its own, let's look at one of the most popular, as Harrison mentioned, and most common sources of funding for creating affordable or supportive housing in general. Those are the 9% federal tax credits. So what you might see as LIHTC, low-income housing tax credits. They are open for applications twice a year, and each round is oversubscribed. Only 28%, for instance, in the last round of the applications got funded. What that means is that all those projects go on the shelf, wait for another year, come back next year. And what happens is that no one is turning off the faucet in those years to stop the increase in need for more affordable housing. That keeps going. That's why we can never catch up with the need by producing more units. This is why a lot of you'll hear shovel-ready project, means they're entitled, they have everything ready to go. It's this last piece of financing they need in order to start building the units. And that is not coming through, so they go on hold. So I wanted to kind of bring this really into focus by giving two examples of mutual housing projects. These are two projects right here in Sacramento. The Wong Center project is what I described earlier as capital A affordable. So there is no supportive housing component to it. And both projects are senior projects, 55 plus ages. However, as you saw in the documentary, although the project doesn't specifically set aside units as supportive, a big portion of our tenants who come in at the 30% of area median income, extremely low income, they are actually coming out of homelessness. So although we haven't tapped into those sources to finance this project, we do provide the services they need so that they can actually age in place or they have upward mobility. What made that project possible was a philanthropic $12.8 million foundation grant from the Wong Family Foundation. These funds don't come across as often as you would think, and that's a very unique experience, having a partner in the community which really believed that this was a need that needed to be addressed. Otherwise, that project would have been on hold for a long time until we figured out where the 12.8 million is going to come from. The Lavender Courtyard project, which is an LGBTQ plus affirming community for seniors, again, 55 plus, that has the layers of financing that we discussed earlier. So project-based vouchers, which are rental assistance that is committed to the units on the project, are what makes that possible, makes it possible to set aside units for senior households who are homeless or have been suffering from chronic homelessness or at risk of homelessness. Half of the units on that project actually have project-based vouchers committed to them and serve that specific population. On top of that, there are other state funding sources and the standard other layers, but each layer comes with additional requirements and also the severity and acuity of the population that we need to serve. So the vouchers, the rental assistance becomes the key funding mechanism in paying for those services. So the issue, as we've laid it out, is not that, oh, is there a need? Is there a demand? I think that's very clear and loud, heard by everyone. But it's really how quickly can we deliver these units? This project has 150 units, and it was fully leased in 3 months. That's 50 units a month. We could not move in people fast enough. When it broke ground and it started a wait list or kind of interest list, we had thousands of people who were interested in the project. Goes through a lottery process, which is, quite it's sad to think that to get shelter and roof over your head, you have to win the lottery, but that's where we currently are. And uh, the 50 units was kind of a record time in order to, move and make sure that the tenants are kind of moving into more stable conditions. Lavender Courtyard, as I mentioned, really relies on the project-based vouchers and the state funding, which is the multifamily housing program, MHP, through the Housing and Community Development. There is always the tax credit layer. And as you see, even with all those additional layers, because they come with their own strings attached, they can barely close the gap that the project needs. So we still had 2.5 million come from the Weinberg Foundation. So there is this dynamic between public-private partnership that really needs to be focused on in order to make these projects possible. So those were success stories. This is another success story, hopefully in the next year. But I wanted to also provide an example of what we are talking about when a project is stuck. This project is fully designed, shovel ready. We have fantastic partners, City of Sacramento, County of Sacramento, who are very supportive of the project. The land is for free, and we are still struggling to get that last layer, which is always these low-income housing tax credits. And the only reason is there's not enough of them and there's so much competition. So, and when we are competing, I will speak for the Sacramento region, this is, there's a nonprofit supportive housing set aside specifically, still not enough money. And a project from Sacramento is competing with projects in LA County, in the Bay Area, and those really don't score the same way. So for us is continuously, how are we going to close that gap? How can we not be so reliant on this program that is not generating the number of units that it needs to? There is on the cost side, I just want to touch on, why supportive housing costs more, because you might have seen a lot of headlines as, why are we building subsidized housing for $1 million per units when you can build market rate units for 100K, or, well, I'm exaggerating. However, it's specifically because the populations that these projects serve. So we are looking at populations that have acuity and need to provide services to make sure that they can move into the unit and not be out in 3 months, be able to actually stay there and get on their feet and continue to have the upward mobility. From a design perspective, that means a lot of amenity spaces, community rooms. The services are a big part of it. The durable finishes, so these units, especially if it's supportive housing, need to have different levels of design. And with senior housing, there are specific design requirements that play into that increased cost. And that really translates into higher construction costs and the kind of sustainable and stable operations. So I think I can kind of skip this one because we already talked about the operational part of the spectrum, is because with the operational funds coming into the projects, being committed to the units, whether it's some funding that can be put in a reserve for the project to serve those units, or if it's the rental assistant ones, those are the leverage points that we use in order to get funding from the private market. So we use those as leverage in order to get private lending, private investment, and that's how we close the gap. Harrison did a great job of really touching on the points when it comes to workforce and the people who actually then continue the operations. This is a general struggle in multifamily in general, just property managers, maintenance, skilled staff. However, it gets an additional layer when we talk about supportive housing, because they need to have higher levels of training and certifications to be able to really handle and meet the needs of the population. So what are we actually funding? It's not just housing. It's places for people to age in with dignity, and places that are sustainable, attainable, and really provide that safety and sustainability of a home. It's housing, it's critical services, and it's the sense of community. No. Sorry, skipped. Uh, these are just some of the like big picture items that we are looking at, and maybe they can turn into policy recommendations. The biggest component is really creating a permanent funding source that the development community can rely on in pursuing these projects and getting them to the finish line. So the two housing bonds that are currently introduced through the Senate and the Assembly are huge critical milestones, and it's when they go on the ballot in November, it's going to be critical for us to do the advocacy necessary to make sure that they come to fruition, because that will really make a huge difference in all these projects that have been stuck in the pipeline for a long time. From the cost point of view, there's a lot that the development community is doing. At Mutual Housing California, we are shifting to factory-built housing or modular housing that you might have heard, in order to really reduce the cost and the timeline how quickly these projects can be built. So we are really talking about cutting the production timeline by 40%. But if that's ready to go, but the funding is not there, we are still stuck. So that's why that permanent financing component is really important. With that, I'll kind of conclude my my presentation. But I think the challenges are many, and if we were to pick one, it's going to really come down to the funding, and that's kind of the common situation that I think we're all solving for. Thank you.
Well, thank you. And again, sharing the complexities, funding is obviously at the core of it, but so many other layers needed to create excellent programs of this nature. So our commissioners have a number of questions. I believe I saw Commissioner Frank jump to the fore. So first question.
Thank you. So I wanted to explore a little bit more about the fact that every funding source brings additional complications and raises prices. Is there anything we could do about that? I mean, is there a reason for that? Or, you know, it just seems so counterintuitive when we're trying to get to low income housing.
That is a great question, and I think it generally feeds off of the policies and the policy priorities not being matching the needs of the community. So, and having a target that is constantly moving creates that challenge. So for a few years, for instance, creating large family projects was the policy orientation. So the development community shifted focus on that because that was the only way you could compete for funding in a somewhat secured way to bring your project to completion. And yes, there is a huge need for large family 2-3 bedroom projects in really high resource areas with access to good schools. Then a few years later, again, policy priority changed. Now it was supportive housing. Actually, supportive housing, permanent supportive housing has been kind of the key concept that the legislature and the state overall has focused on. However, the dynamics of that with a larger development does not quite work. So the requirements for most programs is 25%, 20% supportive housing. Those units need their own additional layers of supportive services, case managers. So now we need to figure out how do we fund that. And if the funding for that, if that priority hasn't translated into the county sources or other sources that need to come through, we have a disconnect. And that really creates that challenge of, okay, we are continuously solving for a gap that the solution adds more to the gap. And that becomes a challenge. So it's really aligning those policy priorities with the programs that actually are targeted to develop that that type of housing.
Commissioner Costa.
Actually, I think
If I could just add a little bit to that, I would just like everyone to expand their imagination of what's possible when it comes to housing development. Like I mentioned early on in my presentation, there's a time in the United States where we were developing 500,000 affordable housing units a year. How did we do that? With a lot of money from the federal government. That is just does not really exist these days. We have this low-income housing tax credit program instead of programs like the Section 8 program and the Section 202 program, which pay for the vast majority of a project's cost, and also add a subsidy on top of it to ensure people can live there long-term affordably. We could get back to that at some point if we, switch around our orientation at the federal level, but it's just been many years of a sort of private sector focus. It's like public-private part. The point of the low-income housing tax credit program was to get some like private sector buy-in to our affordable housing program. It's a Reagan era program that kind of replaced some of these earlier kind of New Deal, Great Society type programs. And I think time has kind of shown these programs to be not great, and the earlier programs to actually have worked a lot better. Who would have thought making things simpler is less expensive? I think at the state level, we also fall into the same kind of trap where, these gap financing programs, they don't necessarily pay for the rest of the low-income housing tax credit deal either. You looked at the slides that Sahar shared, and they had to get, there's a whole category of other on top of, like, they have the major foundation financing, they have the state financing, they have the tax credit financing, and then I don't know if you know off the top of your head how many different entities were in that other categories, but I'm guessing it was probably like at least a handful.
At least, yeah. There are, 4 to 5 different, and it's a lot of, from the development side as well, whether it's like deferred fees or foregone fees and whatever it takes to actually get to production. But one thing that I like to mention sometimes is the number of sources that go into these projects are mind blowing. I think my record is 28 in one project, and each one of those come with their own set of regulations and requirements.
Yeah, I don't know how anyone can think that that's an efficient way to do things. Maybe the state, instead of trying to like give like little bits and crumbs and sprinkling them around, which is like kind of how the state addresses a lot of problems. We don't really solve anything. We kind of just like split up the pie to try and make every interest group happy. Maybe instead of that, we make sure that if we're gap financing a low-income housing tax credit deal, we just fund the rest of it, make it simple. I think that would save a lot of money at the end of the day and make our programs more effective. But that would really require a lot of like a reorientation, I think, of how most of our policymakers think about how they do their jobs, frankly.
Mr. Costa.
Actually, your comments lead to a question. Is there an example of either here or anywhere around the country of a successful kind of partnership-based approach where there was X percent of market rate housing and Y percent of supportive housing that actually worked? And if so, without all the complexity, what was the secret sauce that helped make that happen?
Just to clarify, are you thinking of like a building where there's market rate units and then there?
Yeah, and supportive housing. Because I wasn't aware. I'm very aware, like most people, I think, are that that there is a market rate and then under market rate affordable housing. That kind of model exists everywhere. But is there a model where you've had the market rate and you've had supportive housing in the same structure, and it actually kind of worked?
Not in my experience, and I cannot think of a case that I know of. But the layer of affordable and market rate together has been practiced many times around the state.
Right.
It's a common practice, and those are usually the affordable portion. It's the 50% area median income and below. So that is the requirement, and is usually limited to 20% of the units for previous programs that existed. So those programs also don't exist anymore. So I don't think anyone is continuing the model of market rate and affordable together. Adding supportive housing, I think that is tricky because you are working with completely different skill levels when it comes to the development company itself and their compliance and the operations people, because there is just so many different layers of complexity that goes into when a very special population needs to be served versus, market rate people come in and leave. There aren't any services attached to those units. They don't need, case managers or help with maintaining their units. And if the ownership group does not have that expertise, it does not quite work well, or it's not an efficient way of doing that. Always doing it at scale creates a lot of efficiencies, not only from production point of view, but also from operational point of view.
Thank you.
Yes, thank you. Commissioner Castile.
Thank you. What technology is being leveraged to align and replicate what works at scale?
Technology is something that construction industry has been very away from for a long time. But I think that's a really good question, as we are trying to get more innovative to cut costs, because that's the only part of the equation that the development side of the work has control over. How do we do this more efficiently? How can we produce the units faster? So factory built housing, that is not a new concept. It's not a new technology. It's been used internationally for a very long time, and it's existed in the US at least for 4 decades. However, it's just the industry has been very slow to adapt and to bring it on. On our side, that's what we are doing. We've committed to a pipeline of 5 of our projects, working really with one factory, one general contractor, and one architect, because we don't need to treat these projects, each one as a unicorn. We can really create efficiencies on how they are built in order to rein in the cost and the time portion of that. From a financing point of view, I cannot really think of any technological advances, but I don't know if Harrison has anything to add.
Yeah, I don't know if there's any financing technological advances, but I will say, just to add, when it comes to factory built housing, that has been a focus of the state legislature this year. There was a whole bill package around incentivizing more usage of factory built housing and making it easier for that industry to supply, more affordable housing to Californians. So that is something that's on the mind of policymakers these days.
Thank you both. Thank you both. Sorry, I want to add one thing, because we just said factory built housing, assuming that the audience or all the commissioners are familiar with. So these are, we are not talking about prefab housing. This is actually similar or higher quality to standard construction. The only difference is, instead of building the units on site, they build them in a factory, then ship them to the site, and it goes up in a much faster pace, and it creates less issues for the surrounding neighborhoods, but wanted to clarify that.
I think we should add the addition of international companies coming now, home builders coming to California, seeing our market more for market rate, but there are opportunities on how they're improving climate-based issues around housing, all to be included in this, something that we should all consider how it can be put into this entire supportive housing system. Commissioner Edelman.
Well, first, I just want to thank the two of you. This has been a terrific presentation. As someone who's built affordable housing, senior housing, had the understanding the complexity of it is one of the basic problems. And HUD 202, and I'm older than the two of you, but in my years, that was the best program we had. And it was simple in so many ways. And if there's ever a way we can get back to that, that would be a blessing. So thank you both.
Thank you.
Thanks.
And we received one additional question, a little bit more specific. If you could both address this, can you discuss the pausing of project-based vouchers and its effect on development?
Absolutely. And I'm so glad that that question came through. So at the federal level, because project-based vouchers and housing choice vouchers, or what Harrison referred to as Section 8, are the rental subsidies. The housing choice voucher, HCV, goes with the tenant. So a tenant 6 years a voucher, and they can go and find any unit, any landlord who actually would take their voucher and be able to occupy them. The project-based vouchers, they commit that voucher to that specific physical unit in that development. The risk of, well, most jurisdictions actually have paused awarding any project-based vouchers at this point, and that is coming from a pressure on the federal level because they are stopping the funding for that program or is at risk of stopping. So there is a huge need for advocacy at state and federal level to make sure that that program continues. What happens is we are already seeing ripple effects on this, so from the private market, because when you do supportive housing, the lenders and investors want to see that you have the operational subsidies to do that. When the operational subsidy at risk and it might go away and there is no contract that commits it for 20 years to the project, they don't underwrite it. What that means is that now we can't leverage those sources to build the housing. We are already seeing a bit more skepticism towards supportive housing in general. Most institutional lenders and investors are saying, we are being careful with the supportive housing projects. Do you have anything that is just affordable and doesn't have the supportive component? Or if you have that, or do you have the vouchers? So if that program is at any risk, it's going to be a huge, huge hit to an already slow industry. And we, as I mentioned, we can't keep up with the demand as is, and that would be a huge setback in general.
Mm. Yes. Okay.
Yeah, so just to kind of add on to that, I thought that was a great overview, but really the federal government has been asleep at the wheel for the last like 3 or 4 plus decades when it comes to housing needs across the nation. California is at the bleeding edge of all these housing issues, but we are certainly not the only ones. It's nationwide. And there just really has not been any real expansions in HUD budgets. There hasn't been expansions to the project-based voucher programs. Right now, we're seeing cutbacks from the federal government at a time when people's pocketbooks are being hit even harder than ever before, possibly, or at least in my lifetime. So certainly a lot of the problems that we see in California, and I think this is one of the big misunderstandings that a lot of people who talk about the issue here in California is it's a lot of it does trickle down from the federal government. And yeah, we don't set monetary policy and we can't just print money here. We have to have a balanced budget. So we can't go into a bunch of debt to fix some of these problems that, the federal government in possibly a different era or in a different administration would be able to just kind of fix like that and spend a bunch of money on.
Thank you, and for bringing us around from the beginning of talking about the importance of financing behind this, coming back to that's still the fundamental issue, but the complexity of this entire area, of how many different aspects there are to really moving on this, and again, some of the challenges. So thank you so much.